So we have a lot of work to do together to ride the new horses. Bianca Buurman, ladies and gentlemen, she is professor in acute elderly care, but she is also the chair of the biggest professional association in the Netherlands, nurses, practitioners, etc. So we talked about the role of nurses, etc. Bianca, take the floor. And what is, in your opinion, the role of the nurses in digitalization healthcare?
Yeah, I would love to talk about that. And thank you very much for the invitation to be here today. There are 29 million nurses around the world. We constitute of 50% of all healthcare workers in the healthcare system. Imagine what an impact we can have if we are partners in driving digitalization of healthcare. And this is what I want to discuss with you today. How can we position nurses as key drivers of change? And I realize that I need the clicker. Because I think that nurses can play a pivotal role in the future. And if you look at nursing in 2040, I realize it's really hard to envision like the speed of technology and what we are at around technology in 2040. But if I think about nursing in 2040, I know for sure that we move away from institutions and that the home will be much more the central place of care. I think that also digitalization and ICT will help us to train our healthcare professionals in a very different way, for example, by simulation learning. And because we now have shortages for nursing placements across the world, this can really also help to train and educate more nurses and make them also digital savvy. The third thing that I think is going to happen, and I think that Dave has already explained the impact it has on patients, that it will also help us as nurses to use data much more than we do now, and then with the data, focus on collective prevention, early warning, how can we prevent certain crisis situations to happen. And I think that is really very promising. But on the other hand, I also do think that nursing in 2040 will also be still be around the human touch and human interaction. If I look at where we are now, I see still a big gap. So on the one hand, we have all these developments in digitalization, ICT, the data, but on the other hand, there's the nursing workforce and the process, and they are not, these two developments, I see they are not well aligned yet. And I think that we have to do a lot to close that gap. Because, as already mentioned, we are expecting a shortage of 4.5 million nurses and 10 million healthcare workers in general. And I see two important strategies. On the one hand, I think it is about diminishing the care demand from patients. But on the other hand, also ways to educate and retain nurses. And these two developments or these two strategies go hand in hand. And I want to talk to you about like the agenda for the future and how we can really bridge that gap. So these are the four topics I want to address with you today. First of all, I think it's really important to prove outcomes, but then starting from the home situation. The second thing I think that we need to do in our healthcare system is position nurses as key drivers of change, and I will go a little bit more into how we can do that. The third thing is building a learning healthcare system, and it's actually also what Dave mentioned. How can nurses really use the data, and how can we then learn much more about the effective strategies and so on? And the fourth point will be about lifelong learning and innovation. So if you look at like the place of care that will shift really from institutions to the home situation, I think it's already really happening. We see much more nursing home care at home. Mental health care in the Netherlands is and I think worldwide is much more provided in the home situation. But also, there's a lot of shift from hospital care to the home situation. And I think it's a really good thing. Because in the home situation, the relationship with the patient is different. It's much more, there's much more equality. You're a guest in a patient's home, and much more often, what patients find important is more central in the discussion. But it's also really helping us to improve outcomes. And here you see a picture of our healthcare system and how currently a lot of people transition through the healthcare system. So if you're an older person, for example, you start at home. If you have a crisis situation, you will go to the emergency department, then you will go to the hospital, you're treated there, you have functional decline, you go to a nursing home for rehabilitation, then you need nursing home care, and then you go, you return back home. But what if we design from the home situation and we implement much more online remote monitoring, or if we implement much more ways to really support people in the home situation, for example, with hospital at home, but even better, to prevent crisis situations to happen if we have the data. It will reduce care transitions, and that will definitely lead to better outcomes. And the evidence is also around there that it has less functional decline, less people that are fluctuating through the healthcare system, but also less healthcare costs. And I think what is needed then is to design these care pathways from the home situation, and not only for medical care, but actually if we think about remote monitoring and providing care at home, it should also be about mental health care, it should also be about nursing home care and support of people in their home situation. And to me, as a chair of the Nurses Association, I do a lot of visits through the Netherlands. That is really nice because you get to see a lot. And for me, one of the good examples is in the northern part and the eastern part of the Netherlands, the Acute Monitoring Center. What they actually are doing is really integrating remote monitoring, and what they offer is services to provide nursing home care, medication, personal help, alarms, but also expertise that can be provided through community nurses online. What you then see is that it saves many hospital days, but also a lot of community nursing hours, because the eastern and northern part of the Netherlands, we have more distance to overcome. So it also helps to do it sustainable and in an efficient way. The nice thing is that it also provides with new nursing roles, not only for nurses, but also for carers. And for example, if you think about people until their retirement, it's much more easy for them to do the work, to do the online work until the age of 67. But the good thing is also that they developed this through a shared governance model. So the nurses were really positioned also to drive this innovation. So if you think about retainment of nurses and educating nurses, and I think this is not only true for nurses, but this is true for all healthcare workers, then I think that the main thing that we have to work on is making sure that we are stimulating, or we are working on job engagement and job satisfaction. And that what you can do really is to build shared governance models in your organization. So on the one hand, it means that you would work on, give the professionals a role, and that they use their professionalism to develop new care pathways, to see how digitalization can have a role in the healthcare system. And the other thing is about the working environment, so creating care pathways, making sure that you are educated, there's room for innovation. And this is also something that is really working. The evidence is around. Because if you do this in your organization, then in blue on your right-hand side, then what you see, if you invest in shared governance in your organization, it leads to nurse retention. It's also a very attractive environment for doctors to work in. It creates less burnout, but also it leads to better care for patients. And why does that happen? It is because then it leads to job engagement and work satisfaction. And the green boxes on the left-hand side are the ones that you then need to implement in your organization. So it's about the variation in work. So can you work in the hospital, outside of the hospital? Is it not only about administration? Can you also work on quality improvement? The salary is important, but also a huge part of this job satisfaction is about professional development and your own influence in that. So are there career pathways? Do you experience professional autonomy? Do you have a real role at the table in innovations? And if these boxes tick yes, then it will definitely lead to the outcomes that are mentioned on the right-hand side. So what does that mean then for your organization if you work as a CEO or a manager in an organization? I think that there are some crucial positions that you can fulfill to make sure that you have an environment where digitalization and professional autonomy is stimulated. So on the one hand, it's really important to position chief nursing information officers. In the Netherlands, at least, a lot of the hospitals have them now, but I don't see them as much in nursing home care, community care, but also not in mental health care. And I think if we see the developments and the way that digitalization can help, to overcome like some of the real demands for the future, then these positions are crucial across the healthcare system, not only in the hospital. It also requires to build a shared governance model in your organization, and at least in the Netherlands, this is really on the agenda, and we see a really big improvement in that now. But if you think about also the structures at ward or team level, then it's really also important to think about care innovation centers. These are at a ward or a team level structures where new nurses are trained or new carers are trained, but also where innovations are introduced and where the team together works on new innovations. And that really helps also to create a culture of education and innovation. And that culture is really crucial if we want to move the digitalization forward. I also mentioned that it's really important to think about building a learning healthcare system. And Dave, you also mentioned that the importance of data for you as a patient. I think that is also very true for nurses. We collect a lot of data. It's a lot of administrative burden. But what we don't see is we cannot really use the data right now for improvements. So the data are available often to the management, but like the really feedback loops on data, we don't have it. If you would have that, then as a team or as an organization, it would be much more easy to think about how can we improve nursing practice, how can we improve interprofessional collaboration. For example, around collective prevention, for example, on self-management, but also, for example, on like early warning signals. Making this data available to nurses, but also to other healthcare professionals, that is really crucial. Yeah, then it requires data quality and data availability. I've already heard that there's a lot of GPs and nurses in the audience. It's still very hard if you collaborate together to have the real-time data and also what other colleagues did. If we would have better data quality, it would also help us and enable us to increase knowledge about effective nursing interventions around digitalization, but also in a broader sense. And this is really crucial because we are expecting a shortage if we want to see, if we want to implement new interventions like working with ICT and data, you also want to know what it does on the workforce and what it does on the patients. And I'm very convinced that if we do that, then it will lead to better decisions about care and better outcomes. So this requires actually to see nursing work in a different way. We now see mainly nursing as something that we do on the bedside. And yes, that will be the way that nurses, that will be a large part of the work of nurses, direct patient care or direct patient care through monitoring or other ways. But it is also very crucial in integrated capacity management to acknowledge the other roles of nurses, like quality improvers, for education. Because if we don't acknowledge that, we keep working the way we do. So we need that time to have that different role, and then with that different role, we have the ability to help change it. The last thing I want to highlight is also the importance of digital savviness, because I've spoken about the role of nurses and what they can mean in our healthcare system. But we also know that a lot of the nurses are still digital starters, so they are not able to really work with the data and the technology. And Dave also mentioned that this may be also true for patients. So increasing digital skills is also very important for the future to close the gap. And by doing that, you lower also work stress for people, but also help to increase work engagements. The last thing I want to mention is like really good examples of like how can you do that in education. The Erasmus MC has a really nice example in Create for Care, where nurses find problems in their daily work, and then they work together with technological or design students to together create solutions for that problem. And it has really increased the innovation culture in the hospital, but it also led to a lot of scalable solutions that could be used in nursing practice. So to summarize, the future of nursing is bright and promising. There are 29 million nurses around the world, and they can make a huge difference in digital transformation. At least as a nursing organization, we will pursue the presented agenda. But I really want to encourage you, all of you here in the audience, to also help achieve this agenda, because I think that then this is a way to close the gap, improve outcomes, and to provide to be able to provide high-level quality care. Thank you.
Thank you, Bianca. Bianca, I'm wondering, you gave us an example of a monitoring system which really works in the northern and eastern parts of the Netherlands. Have you also already find examples of how nurses can be skilled in a digital way? Do you already see good examples in the Netherlands?
We have in the Netherlands. I have to say the Dutch word because it's digitaal vaardig in de zorg.
Digital literacy.
Digital literacy, but it's a program where they explicitly work with organizations to make sure that people, that nurses are, they become more skilled, and this can be really basic, like how to work with the programs, the administration programs, but also a little bit more advanced. And I think, like for example, the example I showed with Create for Care, I think the good thing there is that by working together with a technology or design student, by doing it on the job, you learn also how to
a good idea,
how to use it.
Yeah. And then you get also less fear to use it. Question from you, because I realize that there are a lot of practitioners also in the room. I go upstairs this time. Hello, who are you?
Hello, my name is Paul Roos from the Netherlands. Thank you, Bianca, for your presentation. I was wondering, how do you see the role of the Dutch National Nurses Association towards digitalization and the things that are needed to be done to get nurses to be digitally literate?
Yeah, that's a very good question, and actually this is really high on our strategic agenda. We started with Lucien to advise us about it, and also to to discuss what is going on, in digitalization. I think the 4 things that we mention, that are at least things that we want to pursue. We have a new guideline institute, so there also digitalization has a big role, but also creating the positions in the organizations to become organizations where digitalization can have a place. That's also really important for us.
Thank you. Other questions? I see there one here.
Here,
Yeah. Wait one moment, but I'm standing here, so otherwise I have to cross
Yeah.
this big hole.
You seem very fit.
I am. Yeah. I'm riding horses, so.
Hi. Do you want me to stand?
It's not necessary.
Annelies van den Berg, patiëntenregie. What I'm wondering, I've always had a vision that nurses are ambassadors for patients in their healthcare. They build a bridge between doctors and patients. Yeah, they build a bridge because they experience the patient every day. But what surprises me, and what you do, what you propose, is to bring the role up to a very advanced level, and I think that's really good. We should really listen to that. But what I miss in your story is when you talk about governance, the role of the patient's council, for instance. Why not include them in the governance system structure?
Yeah.
Very good question.
Yeah, I think that is very important. The first part, about thinking about the care pathways from home, I think that is really something really to pursue also together with patient, and especially if I heard about Dave's story. I think if we would both do what we proposed, then I think that's the nurses and patients can be a big driver. I think also in organizations, in the structures. We are now already working with patient organizations, but I think that personally, I think that we should take that several steps further, because now in an organization there's the client's council, but I think that there's way more opportunities to work together to pursue that. So I haven't mentioned that, but I strongly believe that we should do that. Yeah.
There's one word this week that I heard very often.
Yeah.
Collaboration.
Yeah.
Collaboration to design a transformative healthcare. Thank you so much, Bianca, for joining us.
Thank you.
Time for a break, time for coffee, other things, and of course the expo here downstairs and upstairs. Please enjoy.